Hi everyone, and welcome back to Life in the Crapper with Zach. Today's a fairly shorter video. It's about how to inject Humira and kind of what to expect the first time you get your Humira shipment. And as we've said before, Humira is a biological agent, a TNF inhibitor. It binds to the TNF receptors and thereby helping to prevent inflammation. So here you go, you get to see me in my kind of bearded McDuff glory from when I filmed this over the summer. Hope you enjoy. Good health.
Hey guys, it's Zach with Life in the Crapper. It's been a while since I've done a vlog, so I don't know when this will show up. It'll show up at some point. Long story short, I had another colonoscopy. They said we can definitely tell it's Crohn's now, so we need to put you on this biologic therapy called Humira, which you've probably seen TV commercials for. And what it does is it works to inhibit tumor necrosis factor, which Crohn's patients seem to produce too much of, which causes the inflammation. So after much haggling with the insurance company, I finally have my Humira here. This is a $6,000 box we have right here. So let's see what's inside. We have a big foil package, almost like Meals on Wheels. It looks like a lot of your typical prescription info that you would get at a pharmacy, and a nice little sign from my pharmacy that says, "We're listening." Yeah, they listened to a lot of complaining when they told me I was going to have to pay $1,000 so I wouldn't have to bleed out the butt. But anyways, let's get this open, and you see we have ice packs. This is $500 ice. This is $750 ice. This would probably be $200. But lo and behold, here we come to the Humira box. And we get this open. And there's also $500 of ice at the bottom, keeping it cold. Open up here. Then we have the Crohn's starter pack. Now, for the first time, I'm going to inject 4 pens into me, 1 into each leg and then 1 into each side of the stomach. And then every 2 weeks I will take another pen. So this kit actually includes 6. There's 1 here, 2, 4, 6. And yeah, it has all the information here. You can actually go to the Humira website and they have a video showing you how to dose. And there's plenty of other videos out there on YouTube, but I will actually probably do one of those too. So this is the pack. This is how it comes. Easy, right? Okay, so let me preface this with I'm not a doctor, I'm not an authority, but I'm just going to show you my process as I do this. The first time you get Humira, you'll probably do it with a doctor for your starter injections, and they'll show you how to do it, and they won't let you do it until they're sure you can do it comfortably. So I'm just going to walk you through it, similar to how Humira does. So please refer to other sources if I am unclear about anything. You need to have, a clean space that you're comfortable with, and I have a paper towel laid out with my cotton swab, and I have the pen taken out of the package. So I took it out and I washed my hands, and there's a gray cap and there's a plum colored cap. And what you want to do is you want to look through this little window and make sure that the solution is in there at that fill line. And then you flip it upside down and you make sure that there's no bubbles. If there are any bubbles, you just tap it a little bit. So I'm going to put that down now. And I'm going to take the alcohol swab, and I'm going to prepare the injection site. Now, there's 4 areas you can inject in thigh, stomach, not within 2 inches of the belly button. Now, this is supposed to be subcutaneous, so it goes underneath the fat. And even if you're someone really muscular, you still have kind of that layer of skin and fat, before you get to the muscle. So what you do is you pinch the skin, and then when you put the pen on top, make sure you're putting it straight in 90-degree angle so that the needle doesn't go through the skin into your finger. So I'm going to do the first one on my leg here. I'm going to turn this like this. I'm going to actually start with 1 facing up, and you take this straight off. Don't twist. The needle is actually down there inside. It has a little white plastic thing making sure you don't accidentally stick yourself prematurely. So then you're going to flip it upside down. And then you're going to take the plum colored cap off as well. Now this reveals the plunger. When you hit it, you're going to hear a loud click, and then it's going to start to dispense. So the important thing is you may feel that initial shock, but you have to keep it in until it finishes dispensing, because if you jerk it out prematurely, it's going to keep dispensing and you're going to basically waste the solution. And you'll know that it's done when like a little yellow marker appears in this window. That'll signify that everything has been dispensed. Wait a few seconds, pull it out of the flesh. Just another tip to help it not hurt is you want to store Humira in a refrigerated environment. So when you first take it out of the refrigerator, give it a few minutes to kind of get up to more room temperature. So let's give this a go. Okay, that actually was not so bad. It hurt a little bit more after the stuff was actually going in. There's a little bit of blood. Use like a little cotton swab to dab it. And make sure you dispose of the pen in a milk jug or a sharps container for safety. That's just the proper way to do it. And so now I will do that on the other spots of my body. And it's that simple. So, hope that helps.